Hello, and welcome to the AT and Osteo Chronicles. So lately, we've been focusing a lot on the things that people can do after a concussion, how to help manage things, progress along. And one of the things that we haven't touched on is how some concussions might be different and explaining why there might be those differences. So today we're with Dr. Silvana, sorry, I don't know where that happened. Silvana, who is a naturopath here to talk to us about hormones and how that could be impacting your concussion recovery.
Hi, everyone. Dr. Silvana Jakupovic. I'm from Catalyst Kinetics out in Surrey, BC. And yep, super excited to talk about how hormones can be impacted by concussions, whether mild or severe.
Yeah, well, let me start off with just a little bit of, I suppose, introspection in terms of how this conversation even decided to come about. Like I've noticed over years, lots of conversation, predominantly with the female concussed individual, but it also has been some conversations around men as well, in terms of the change in the hormonal patterns after concussion and how little conversation there is about it. It really depends on the physician. I think there seems to be very few physicians who would agree that the hormonal changes that a woman might have post-concussion are as a result of the concussion and not just a coincidence. But there have been definitely times where I've worked with people where their menstrual cycle changed. Um, Maybe fertility has been compromised. All of a sudden, if they're using like an IUD, there's some shifts, like the body is going through shifts with that at the same time. And then we also know via pink concussions that there's a certain time of month where if you get an injury, a brain injury, it has a a longer recovery rate depending on where you are in the menstrual cycle. So I find it pretty fascinating to talk about it. And so, yeah, we're really, really stoked to have Silvana here to tell us a little bit more about what's really going on and so that people can have a better understanding of what's happening to their body and the types of conversations they could have with their healthcare practitioner.
Okay, so let's start a little bit more about why the hormones are so important or how that can dysregulate the body. If you don't mind sharing your opinion on that.
So definitely, yeah, the thing about concussions and hormones, um, those biomechanical forces from a concussion, they can completely damage the hormonal system, and it can happen through different mechanisms, many different mechanisms, such as direct trauma to that hypothalamus or pituitary gland, damage to the veins that connect them, global brain ischemia, and sometimes even in more severe cases, pituitary stalk transection, which is, of course, much more severe, but then this can all trigger a cascade of hormonal disruptions. And when that happens, there's a lot of downstream effects that are very widespread, can cause fatigue, cognitive dysfunction, mood changes, metabolic disruption, et cetera, et cetera.
Fantastic. So for for somebody who's watching us right now, or will be watching this later, what does all of that mean for somebody who has no idea what you just said?
Yeah.
Like,
So
like,
the yeah. So the hypothalamus and the pituitary, they are essentially the brain's master endocrine control center. So they're ruling virtually every hormonal axis in the body. So when this control center is disrupted, then all of those previously mentioned downstream effects can occur. And one of the ways that this becomes disrupted is through a concussion or a traumatic brain injury.
and does it have to be like a direct hit to the head? Can it be whiplash related?
Yeah, for sure can be whiplash related because even that motion itself can cause brain injury. It just hitting against your skull essentially. So it doesn't even have to be direct contact.
How would somebody know that that could be affected? How would their body respond differently?
So most important, definitely in that acute phase, it's hard to tell whether it's, just a result of the concussion, if hormones have been disrupted. Usually, if there's no hormonal disruption, then concussion recovery is on average like 1 to 3 months or so with proper physio, rehab, etc. But if you are having persistent fatigue, not, it's not doesn't make sense related to the amount of activity that's being done. If there are persistent mood changes, persistent behavioral changes, changes in libido, sexual function, menstrual cycle, et cetera, especially persisting beyond 3 months, then this is where there should be further intervention and definitely like baseline hormone testing to be completed.
Sorry, I
Um,
just have another question. Because you said the endocrine, so we talk about like how that could potentially be like blood sugar, right? Levels and spikes in
Mhm.
that. So changes in people's appetite for long
Yes.
term, changes in their, I guess, weight gain, all that kind of stuff
Yeah.
too.
All of
Or
that can be impacted. Even in thyroid function as well. So honestly, any metabolic disruption can occur from a concussion. Um, that's why it's not just sex hormones. It's like all the hormones that have to be investigated essentially.
yeah, and I guess, from a practitioner perspective, a really good intake is really important because a lot of people wouldn't necessarily put down that they're on thyroid medication or they don't think it's relevant or they wouldn't, maybe it fluctuates anyway. And so they wouldn't be looking for, oh, my thyroid could have actually been affected by this accident that I've had. Um, so that's really, I think that's really important for people to understand as well. Uh,
Mhm.
yeah, so thank you for that. Um, so are there any other Are there any other symptoms that we would want to be looking at that aren't covered in sort of like this sort of grand scheme of things? I mean, with women, you're looking at like what you just said, like menstrual changes and stuff like that, and persistent fatigue. Is there anything else that's been overlooked in a symptom scenario?
Um, Most commonly, it is the fatigue, the mood changes, cognitive difficulties, whether it's like cognitive slowing, brain fog, impaired processing speed, working memory, et cetera, et cetera. But even sleep disruption is so significant. That's also one of the more common symptoms after a concussion. The weight gain, as mentioned, temperature dysregulation. So if a patient expresses difficulty to warm up. They're always feeling cold all of a sudden. That's part of it as well. So cold intolerance essentially. Um, and then of course sexual function. So loss of libido, erectile dysfunction, the menstrual irregularities. These are all huge.
can they also be the opposite? So like the warm all the time, trouble cooling,
I'm
other
sure
things
it
like that.
can. I'm sure it can present that way. I would say most commonly it's the cold intolerance, but
Okay.
definitely if it's more so related to sex hormones, if there was a change in, let's say, like estrogen production, et cetera, then definitely like night sweats, hot flashes, difficulty cooling down.
And would you
Yeah,
see a difference in like the younger population? So someone who's just gone through, I guess, puberty versus somebody who's going through menopause or has gone through menopause?
Yeah, because women who
Because
are already in perimenopause, especially, they already have fluctuating hormone levels. So then it's a little bit harder to distinguish concussion induced hormonal changes from natural hormone variability. But usually it's like that additive effect of the perimenopause with the concussion on an already unstable, you know, hypothalamic pituitary axis, so already unstable hormone regulation. And then that can further amplify symptoms in perimenopausal women, especially symptoms like mood swings, sleep disruption, brain fog, etc.
And would these be like similar in men? Like we are leaning heavily towards women. Um, you know, I think because there's always so much going on in the female
Mhm.
hormonal realm. Um,
Yeah.
what would you, is there anything different that you would see in the male population who have been affected? My only experience from that perspective from treating concussions is probably fatigue, loss of libido. And then their doctor like is immediately testing their pituitary gland. And
Yeah.
that's the only thing I've ever really come across in my practice with men.
Yeah, most common I would say with men is mood changes, behavioral changes. That's pretty significant. And then, of course, loss of libido or even erectile dysfunction, and then subsequent testosterone deficiency after the injury as well.
Okay.
And I'm guessing you're seeing the same changes similar to like midlife versus younger populations, or are
The,
you seeing kind of
so
that fluctuation still, like women, because men tend to have a dip in testosterone at middle age as well?
it's similar, but I would say that the effect is more pronounced in midlife rather than the younger population when it comes to the concussions. But then it also depends on the cumulative effect. So by midlife, if they've had several concussions repeatedly over however many years, that's going to have a greater impact than a younger patient who comes in and it's like their first concussion or second concussion.
That makes sense because that's what we see generally with most symptoms of a concussion. The more you've had, the broader the symptoms, the longer it takes for recovery and all of that.
Yeah. Yeah, exactly. Because repeated head trauma, it will have that cumulative effect on pituitary function. But then there's also research of an autoimmune mechanism that may explain that cumulative effect, where essentially there are anti pituitary and anti hypothalamic antibodies that are being produced with subsequent head trauma. And then that would then it would amplify the autoimmune response over time as well. So then that would amplify the signs and symptoms after the concussions.
Thank you. So, if somebody recognizes these issues, recommending that they go and get their hormones looked at or check in with their doctor, or kind of looking for what steps should they take once they are like, hey, something else might be going on.
Yeah. So usually, so in my clinical setting where I work in a multidisciplinary clinic, I don't usually see post concussive patients until it's like a few months post concussion, where they've essentially plateaued or not made progress with physio, chiro, um, regular rehabilitation essentially. And then this is when I do a complete screen, full health history, screen for any clinical signs of hypopituitarism. And then I'd recommend that baseline blood work. So things like, cortisol, which is the stress hormone, looking for morning cortisol levels, looking for thyroid function, sex hormones, even biomarkers for like growth hormone deficiency, which can occur after concussion, et cetera, et cetera. And then from there, we'd kind of go on whether we begin treatment, whether we need further testing, et cetera.
What kind of treatments would you be looking at? Like, would it be something like HRT or is it more like supplements? Like, what does that look like for somebody who they come in, they do all the testing. Okay, now there's something, there's something amiss that needs to be addressed. What could they expect from a potential treatment protocol?
So it definitely varies person to person. Sometimes patients actually do need hormone replacement therapy, whether that's a male who needs testosterone therapy, a female who needs estrogen, progesterone, testosterone, etc. Even with growth hormone deficiency, though I can't work with this directly. Sometimes individuals need growth hormone as a replacement, or even if their cortisol is dramatically decreased, especially morning cortisol, they may need support in that. Other areas include supplements. Sorry. Other areas include supplements. So whether that's adaptogens, these are herbs or vitamins and minerals that increase our body's resistance.
Dr. Silvana has a little bit of a dry throat today, so she did warn us at the beginning.
Yeah.
Sorry about that.
Okay.
Battling it, but it's okay. um, Adaptogens increase our body's resistance to stress essentially and modulate our cortisol levels. So whether we need to lower them, increase them. And then there's many nutrients that are needed, like omega-3s, which have direct like neuroprotective effects. Um, Decrease neuroinflammation. There's vitamin D, creatine, curcumin, NAC, et cetera, et cetera. There's many different supplements that may be implemented as well, but it's always like a case by case basis.
Wow. That was a lot. So,
Yeah,
yeah, it depends on what they're experiencing, the symptoms they're having, and really what the basis of it is.
exactly. So it's not just like one size fits all.
Yeah. Um, I had a question in my head and I've completely forgotten it now. Which is, I'll probably think about it like tonight at 3 in the morning or something like that. Because that's usually what happens. But I do have one question. How does, of course, with your job, I mean, you're in the naturopathic world, right? And so both Brynn and I will see people who are maybe a little bit more in the allopathic. They want to go to their GP. And could you talk to us a little bit about how they can approach that conversation with a GP who may be reluctant to acknowledge what's going on? Maybe they have access to a naturopath as a second opinion or an alternative avenue, but maybe they don't have access to a naturopath for whatever the reason might be. How can we get people to understand like what kind of questions they should be asking? How could they advocate for themselves if they're feeling, well, they've just learned that this could be a conversation they need to have, but then also if
Mhm.
there's a little bit of pushback, um, how
How
would
they
you
can
approach?
advocate. Yeah.
Yeah.
Yeah, it's definitely when there's a little bit of pushback from GPs, it definitely makes it more difficult. Um, in situations where I'm working with a patient and if I'd recommend testing, but because I have to do private pay testing, unfortunately, it's not covered by MSP, then usually I'm writing a referral letter or a reference letter to their GP with a full explanation describing why I believe this blood work is needed. But if a patient doesn't have a naturopath, they don't have someone else to advocate for them, it's difficult, but the best case scenario is honestly to show up to your appointment with a bunch of research, unfortunately describing that, if this has been persisting for this long, they've been doing the proper rehab, they've been going to their appointments, they're still experiencing, this and this, and nothing is improving and they've plateaued at this point, then bringing up the conversation of could it be a hormonal disruption because they've read it online, they've heard it online, they've looked into it themselves. It doesn't always work, but it's honestly the best way if you have no one else to advocate for yourself. Alternatively, finding another GP, whether it's through a walk-in, whether, online walk-in doctors, things like that, those are available to us as well. And in some scenarios where my patient's GP won't work with them, they'll look for other doctors online and kind of give them a layout of what's going on. And then that doctor is willing to work with them. So it varies. It's like you have to jump through some loopholes, unfortunately. But if they don't have access to a naturopath, then that's pretty much the best bet, is just going in there with all your research.
Yeah. Yeah, and it can be difficult to access a specialist from that perspective too. I was reading one book, I can't remember the name of it now, but what it generally talked about is how, an endocrinologist would really only look at a certain set of hormones, and a gynecologist will only look at another set of hormones. But in this case, it seems clear that they're intertwining.
Mhm.
And you can't just only see the endocrine specialist and not address the other things and vice versa. But how it was just explained in this book was that neither specialist will step outside their box into the other specialist's box.
Yeah, it makes it
And
difficult
Yeah.
for sure.
yeah, yeah. But I think that's important for people to know and understand, because I think if you don't have a lot of um, experience within the medical community, I don't think people realize the where the boundaries are between specialists, and they bump up
Yeah.
against some really challenging and tough conversations because they're not being heard, or they feel like they're not being heard, but they're not talking to the right specialist. But other than the
Mhm.
naturopath, I think naturopaths are probably the only ones that could be the specialist that looks at both pieces, like in tandem with one another.
Yeah, like we'd be able to order a bunch of different tests. The downside is just that it would be private pay testing.
Yeah.
And then there's additional tests we can look at as well, like the salivary cortisol, so we can see how, the stress hormone is moving throughout the day, or looking at metabolites of your sex hormones and cortisol, because and while that's not referenced in any like major clinical guidelines, it is complementary information as well, to see how are your hormones being metabolized in the body also. So in conjunction with blood work, serum blood work. But the downside still would be that if a patient did need hormone replacement therapy, we are still limited. So we can't prescribe like DHEA, testosterone, any steroid hormones, and we're pretty limited on that end as well. So working with other practitioners, working with a medical doctor would be the ideal situation, but sometimes those relationships are hard to find and even build. But
You've given us a lot to think about and given people a lot to think about. And I think you're right, Jenna. I think that people go into something and they're looking for an answer to all of it, and is very limited on what they can say or do, and that
Yeah.
feels disheartening to them because it took them so long to get those appointments and get those results.
Yeah. Well, and the goal with this episode today is that people can feel like maybe they're armed with a little bit more information, so that when they do go into these appointments, they have a better understanding of what could be potentially happening in their body, but also armed with the information to know what to ask for, to be able to even just have that conversation with their healthcare practitioners, whether it's like seeing an athletic therapist or seeing a physiotherapist, their GP, osteopathy, it doesn't matter who the therapist is, but they can come in with all of this information, because if this hormonal panel is compromised, that bleeds out into other performance areas as well.
Yes. And I think it's also good for us as healthcare practitioners to be able to recognize this and refer them to the right people so that they can get the results that they need. So Dr. Silvana, do you have anything that you would recommend for other healthcare practitioners? Because I know you work in a multidisciplinary. For those that may not work in one with a naturopath, when would we want to consider suggesting that they have their hormones checked or see someone for that?
So definitely, if it's been 2, 3 months of regular therapy, they're doing vestibular rehab, they've been coming to their appointments, doing their, homework, and the progress has plateaued. There's still persisting fatigue, persisting cognitive difficulties, and nothing seems to be explained or helped with any of the therapies that they're doing so far. This is when you'd want to refer out to someone who can do that hormone testing, especially like at the very least, like the baseline blood work to see if something else might be going on. But I'd honestly, I wouldn't continue them on therapy if they've plateaued after 2, 3 months. Like they should continue, but they should be referred elsewhere. It should be a multidisciplinary approach at that mark.
That makes sense.
Yeah, absolutely. And so for someone recovering from a concussion right now, what are two or three things that they could start doing today to support their hormones? So say they live in your area and they're like,
Mhm.
"Yep, I've got an appointment with Silvana, but I can't see her for another 3 or 4 weeks." What are the two or three things that you would recommend for them to start doing?
So this is something that should honestly be started within 24 to 72 hours of the concussion is early like aerobic controlled aerobic exercise. This is one of the most evidence supported interventions for concussion recovery. Even light activity like walking will facilitate recovery more effectively than if you just rest until your symptoms resolve. So that's very important. Prioritizing your sleep hygiene. Sleep disturbance is associated with slower recovery after concussion, but sleep disruption is one of the most common symptoms after a concussion. So even basic practical steps, maintaining consistent sleep wake times, avoiding screens before bed, limiting caffeine, alcohol, nicotine intake. This is very important. And then lastly, managing stress as best as you can. So incorporating relaxation and stress management techniques, whether that's reading, journaling, guided meditations, yoga, etc. Even incorporating vagus nerve stimulation techniques, simple humming, gargling, singing, splashing cold water on your face. So that's what I would prioritize: the light activity, sleep, hygiene, and the stress management.
I
Thank you.
love that.
Yeah.
Absolutely love that. The reason I say that is because that's what athletic trainers do. It's like rest for the 24 hours, come see me the next day. Boom, let's get you moving. Let's get your
Mhm.
symptoms reduced. Let's get you sleeping. And like you said, don't touch any of that stuff, the caffeine, all that, until you're at a spot where you're better. Yeah.
Exactly.
Excellent. Are there any supplements or adaptogens that you would commonly use in the early stages to support hormones?
So again, um, definitely shouldn't just start supplements on your own. Should be alongside a practitioner's recommendation. But usually it's like omega 3s. Those are pretty quick to start for that neuroprotection. NAC, potent antioxidant and combatant for like neuroinflammation, oxidative stress within the body. If sleep is significantly impacted, introducing low dose melatonin, and then kind of adapts from there. But those are the three pretty basic ones, magnesium as well.
That's great. Thank you.
I think that's pretty thorough.
Yeah, I think we pretty much covered all the things that that we wanted to, right? To make sure that people had a good two or three takeaways in terms of hormonal health post concussion. Um, And so so if our listeners haven't been introduced to you yet through the previous podcast that we had you on, um, where where can people find you? Well, coughing right now. Sorry. So I know you can find Dr. Silvana at Catalyst Kinetics Group in New Westminster and South Surrey. So you can see her there. Are you in Coquitlam as well?
Nope, I'm actually primarily in Surrey. US, I kind of just drop in for these training sessions, but to
Oh,
see
okay.
me, it would be primarily in Surrey. But I do have like in-person appointments as well as telehealth, which is through video or phone call. Ideally, though, I'd see the patient in person first before transitioning to the telehealth appointments as well.
Okay.
Okay.
And if we've got anybody who's outside of the province who's watching this, who wants to meet with you virtually, is that a possibility or do they have to be a BC resident?
They have to be in BC,
Okay.
unfortunately. Yeah.
Okay. So then if they're looking for somebody in their area and they're looking for a naturopath, is there anything in particular that you would encourage them to be looking for as they're trying to vet a new therapist for themselves?
Definitely some mention of working in post-concussion environments on the naturopath's profile, webpage, whatever it may be. But ideally, the naturopath has like a free 15-minute consult or meet and greet appointment where the patient can then clarify with that naturopath whether or not they're comfortable working with a post-concussive patient. And I offer those as well.
Awesome. Thank you.
Thank you so much. I think the main takeaways are that if you've plateaued, there could be something else going on. Seek extra help for that. And yeah,
Definitely,
try
yeah.
to get the sleep. Try to move and sleep.
Yeah, the foundations are definitely the most important, but
Awesome. Thank you so much for joining us today.
Thank
thank
you.
you. I apologize for all the coughing.
It worked out. It worked
Yeah,
out. Don't worry. All
absolutely.
right.
All right. Thanks so much. And we'll catch you guys another time.